Regarding the prognosis for the treatment of the multi-rooted teeth with furcation involvement, we have the maxillary first premolar. This tooth, as we mentioned previously, having the furcation area located many millimeters apical to the cemento-enamel junction. So the treatment is very difficult for such a tooth. Beside the premolars having mesial furcation and distal furcation, so there is neighboring tooth, or it is a proximal. There is a proximal area that is very difficult to be treated. So the prognosis for the maxillary first premolar considered poor prognosis. While in case of maxillary molars furcation involvement, it has buccal furcation, mesial furcation, distal furcation. Also, the access to these areas or to the furcation area, especially in the proximal areas, is very difficult for the plaque control. And for the treatment of the furcation, it is very difficult. So the prognosis of the furcation in the maxillary molars is considered not good. But for the mandibular molars, it has two divergent roots, mesial and distal divergent roots, and the furcation is opened buccally and lingually or buccolingually, so it is easy to be treated. So the prognosis for the mandibular molar is considered good. Now we have the treatment of furcation involvement. We have degree 1, scaling and root planing with furcationoplasty. Degree 2, furcationoplasty, tunnel preparation, root resection and tooth hemisection, tooth extraction and guided tissue regeneration. Degree 3, tunnel preparation, root resection and tooth hemisection, tooth extraction and guided tissue regeneration and bone grafting. What are the objectives of treatment of the furcation involvement? First of all is elimination of the microbial plaque from the exposed root surface and the establishment of the anatomy for the affected surface that facilitate the proper self-performed plaque control method. We will start with the treatment of degree 1 furcation involvement. It includes scaling and root planing, which is removal of the hard and soft deposit from the tooth surface and from the root. And the furcationoplasty, this procedure is used in order to widen the narrow entrance of the furcation area. But there are some side effects for this procedure, like the hypersensitivity of the area and increase the root caries, and there will be more destruction to the periodontal tissue. Other procedure including in the treatment of degree 2 furcation involvement is the tunnel preparation. The tunnel preparation is a surgical procedure including the surgical exposure of the entire furcation area, and we remove from the tooth substance and from its surrounding bone until a spiral toothbrush can be moved easily into the furcation area for plaque removal. Other procedure is the root separation, which involves sectioning through the root complex without removal of any root. That means the maintenance of all roots. This is called the root separation. while the root resectioning, it includes the total removal of one or more of the roots of the multi-rooted tooth, and this can be done with a tapered diamond burr, with a cooling with a sterile water, and the cutting must be done very careful, not to take too much substance from the tooth, and not harm the other tooth substance that is found around. Just removal of the undercuts and hard areas. This diagram shows the root resectioning. As we can see, the path of cutting can be done here, and then cut by the diamond burr, and this root will be sacrificed or removed. The undercuts must be smoothened here. There is no undercut should be left around. There are some factors have to be taken into consideration when we decide to select the root to be retained or to be removed. First of all is the amount of the supporting tissues remaining, and this other factor is the stability of the individual root, the root and root canal anatomy. We have to take into consideration that the root which is going to be retained must be endodontically and from the restorative point of view is okay. And other factor is the periapical condition of the root, the position of the root in relation to the adjacent and to the opposing teeth. We know the occlusion have to be correct. The tooth later on will be used as an abutment, so the relation with the adjacent with the opposing have to be a good relation. Other factor is the oral hygiene of the patient, the systemic health of the patient, and neighboring teeth have to be healthy.